Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex, to self-love, to questions about body parts. Let's get this episode started. I am going to explain some different fluids of the body. So I'm going to start with vaginal fluids and then move on to penis fluids. Now, this is in response to a variety of questions about, is it normal for my vaginal discharge to look like snot or really clumpy? And also the difference between pre-cum or pre-ejaculate and semen, to explain why someone is still at risk of pregnancy with pre-ejaculate. So let's start with the vagina fluid. Okay, I swear these are not real. I used an egg for a couple of them. So vaginal fluid, vaginal discharge, is going to change in color and consistency, primarily depending on what type of hormone is most active in your body at that time. So we know that hormone levels fluctuate depending on where you are in your menstrual cycle. And menstrual cycles are just a continuous circle that go period, which is flushing out your uterus of some of the extra tissue in there, to ovulation, which is when your ovary releases an egg, and then back to a period. And the whole point of ovulation is to make a baby, whether you want to or not. So during ovulation is the highest risk of pregnancy for those who have sex with a penis. Now, the thing that drives these changes, the period, ovulation period, are hormones. So that is why your cervical mucus actually changes throughout your cycle. So it's totally normal to have different fluids at different points in your cycle. So we're going to start with, right after your period, estrogen levels are low, and they're going to slowly increase until ovulation. So during that time, your fluid can look a little thin, yellowy, and it's usually a little sticky. And that just means that the estrogen levels are slowly increasing. All right, and then around the time of ovulation is when your estrogen levels are going to be the highest, and that is going to create like a snotty, egg white kind of a discharge, like that. That's an actual egg white, just for demonstration purposes. So it's going to have that kind of snotty consistency. Now, after ovulation, and once the egg has passed, your cervical discharge will turn a little bit thicker, maybe a little clumpier. When you have this clumpy discharge is usually when estrogen has gone down and progesterone increases. Now, oops. Now this is gelatin gone firm, okay? It's not, not usually this thick, but, I mean, if I get in there, oh man, it's funky. Oh, okay, well, here. So kind of like thick and clumpy. Just gross. Got this all over. Wash my hands later. Oh my god, my hands are so sticky. The last fluid is obviously then going to be your period, which can also be clumpy, which is clumps of the lining of your uterus coming out, so clumps of old tissue, and bloody. So, period. And there you go. Now let's switch gears and talk about fluids that come from the penis. So specifically, I want to distinguish between pre-cum or pre-ejaculate and semen. Now, there is a lot of thought out there that pre-cum, or the fluid that comes out of the penis before actual ejaculation or orgasm, doesn't carry any pregnancy risk, but in fact it might. So I want to use a couple of things to demonstrate. This is no longer period blood, it's going to be semen, okay? And then a little amount of fluid in here is going to be pre-ejaculate, okay? So usually pre-ejaculate, the whole purpose is really just to lubricate or moisten up the tube that the semen will come out of and help with the most effective semen ejaculation ever. So it kind of like wets the slide, so to speak. But the issue with pre-cum having semen is that sometimes a few sperm can be in the pee hole or the tubes that pre-cum travel through. So I'm going to use beans to show you the difference between pre-cum and semen. Pre-cum usually has, maybe. Semen, on the other hand, is a lot of fluid. And it's not just sperm. So it's a lot of other fluids that come from different parts of your reproductive tract as well. Semen. Sperm. So here's the difference. Pre-cum, semen. So obviously there's a much higher risk of pregnancy if someone has sex and has ejaculation within the vagina. There's a lot more sperm in ejaculate, but there's still a possibility for some sperm in pre-cum. So always wear protection. That wraps up my fluid demonstration. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.